It's my pleasure to welcome Dr. Brian Elbel. He is the Associate Dean for Research Mission at NYU Langone Health and Professor of Population Health and Health Policy at the NYU Grossman School of Medicine and at NYU Wagner Graduate School of Public Service. He also directs the section on health choice, policy, and evaluation at NYU Grossman. Dr. Elbel examines how policies and the environment influence health and health behaviors, particularly obesity and chronic disease for children and adults. Throughout his research, he seeks to understand how social determinants create differences in outcomes across race, ethnicity, and socioeconomic status, and how policy can be leveraged to reduce these differences. And we're thrilled that he's joined us for one of these GSIS research seminars. So I'm going to turn it over for him to present. And then at the end, we'll have time for Q&A. So folks can use the Q&A function on the webinar, the Zoom webinar. I'll sort of monitor those so that when we get to the Q&A portion, we can have a nice discussion. So over to you, Dr. Elbel. Thanks for joining us.
Thank you so much, Karina. Thank you so much for the invitation. Really happy to be here. Let me do the sharing part now, always the hardest. How is that? All right. I'm assuming we're looking good.
Great.
Unless someone tells me otherwise.
Yep,
great.
Perfect.
Really happy to be here. So I'm going to talk to you about some of our work evaluating food policies in the US. And let me just do a little bit of stage setting. So this is setting the showing over time how obesity rates have changed since 2011. It goes through 2019 in this map, and I'll tell you why in a second. But basically what you're seeing is, pretty much every state's getting more yellow, orange, and into the kind of darker red color. I stop at 2019 here because states were sort of even tipping over into the 40% obesity rate, and so the CDC had to change the color so it doesn't quite look as consistent. But the story has more or less been continuing, where we've been seeing obesity rates coming up. Very recently, in the last couple weeks, a little bit of evidence has come out that says maybe we're plateauing now, which would be great, although it's really a little bit too soon to tell. I think the other thing that is important here is that, you do see differences by race and ethnicity here, right? Particularly differences by men and women. For example, non-Hispanic Black women, this is, again, CDC data as well from 2020. Non-Hispanic Black women have higher obesity rates than other women, but it really is Hispanic men who have the highest obesity rate, kind of second to white men. So again, there are some kind of key differences throughout here as well. So what I'm going to do is talk a little bit about obesity and nutrition policies that we have evaluated, trying to look at these policies as they've been implemented and as they've rolled out. And I'm gonna give you a little bit of a sense of how this work has evolved a bit over time and how we have thought about it. And then I'm going to try to highlight some issues of policy implementation throughout as I'm talking about this stuff. So, and I'm definitely going to try to leave time for questions. So please keep those coming. So I'm first going to give you a couple different studies that we've done that involved original data collection. And this is some of our earlier work when we were just getting going and a lot of obesity policies were rolling out. And we wanted to kind of really jump in and dive in and study these. I'm going to first tell you about a new supermarket that we studied that opened as a result of city tax credits. So New York City had something called the FRESH program, the food retail expansion to support health. The idea is we're going to give both money via financial incentives from tax credits and also zoning incentives. You can kind of change what requirements we usually would have for supermarket operators that moved into a high need area. We did a deep dive about one of the first ones of these that opened in Morrisania in the South Bronx. And the goals of these policies from New York City were to improve healthy food access in high need areas and hopefully change what people are eating. So the program basically said that you could get reductions in your land and building taxes. You didn't have to pay taxes on building materials. You didn't have to pay mortgage-related taxes, as well as zoning, which can be a big deal in New York City, and kind of change what could be built in the area or the size it could be built in the area. And the kind of greenish areas are the places that were allowed to get kind of the full range of incentives there. So you couldn't just kind of open a tire shop and put some chips in there and call it a store. You had to actually have, it's called a supermarket. You actually had to have, an appreciable sized supermarket here. At least half the store had to be for food. 30% had to be for retail space, of the retail space had to be for perishable items, and at least 500 square feet of fresh produce. So, they wouldn't have to be a mega store, but they had to be sort of a reasonable sized store in New York City. This is the one we studied in the South Bronx. It happened to be in the bottom of a low-income housing complex, which had been open for a while before the store opened. It was pretty big. It was a nice store. It happened to get both the financial and the zoning incentives. And we matched this with a comparison site in the Bronx of Highbridge, and I'll show you some data about where that is. We did a whole bunch of surveys, right? We had research teams kind of throughout these areas, and we ended up doing over 6,000 street intercept surveys, stopping people on the street and asking them questions. We did almost 2,000 follow-up dietary recalls by phone, so really big lift here. We did this both for adults and for parents of kids aged 3 to 10. We did this, every day of the week, English and Spanish. Anyone who looked to be over 18. We did this before, pretty quickly after, and 1 year after. So we did give some time for sort of the store to kind of kick in, if you will, and have people learn about it. Just to give you a sense of where we are, this is the South Bronx. So this is the supermarket that opened. This red line here. The yellow baskets, sorry, this red cart there. The yellow baskets are currently existing supermarkets in the neighborhood. So it wasn't like, this is not the middle of rural Iowa where there's nothing. This is still New York City. Although, you live kind of just to the right of that and you're walking a long way or taking a complicated bus, and the South Bronx is really hilly. To the left here, around the blue line, is our comparison group, and that's Yankee Stadium down there, just to give you a sense of scale. All those purple dots are where our subjects lived. And so what do we find, right? We found that this didn't have a huge impact, right? At least for the population as a whole. We didn't see change in fruit and vegetables consumed. We didn't see changes in unhealthy snack food consumed. We didn't see a change in food availability at the home or shopping patterns. In fact, only about a third of the sample noticed a new store, which, as you think about the context, maybe isn't that surprising, right? A lot of folks already live close to a supermarket, so maybe the one right near them wasn't going to have a big impact. But when we tried to zone in on people just living around the store within kind of the half a mile, we started to see more of an impact, right? Again, we weren't super powered to see this really well, but we did see a little bit more here. We saw an increase in those reported always having fresh food available in the home compared to those who live farther away, and a higher consumption of fruit, vegetables, water, and a lower consumption of soft drinks and pastries. So this was a sort of a sign or signal that, like, maybe there's going to be something important going on here that we need to look at more later. And in a minute, I'll tell you how we did that kind of further look. So that's one policy. The next one I'm going to tell you about is menu labeling policy. So this was one of the first large-scale policies to think about influencing the food environment in the U.S. It's not a policy where we're like going in and building something new, or we're taking something out, not making food available. It really is more about an information education approach. And we did a study, one of the first studies on this actually, that looked at individual level analysis of change in purchasing and visiting restaurants, to see when you put calories up on a menu board in a fast food restaurant, does it change people's purchasing behaviors, was the idea. And we studied McDonald's, Burger King's, and KFC's, 42 restaurants initially in New York City, using Newark as a comparison site. A later study doing it with a larger R01, doing it in Philadelphia, using Baltimore as a comparison site. We found out the best kind of comparison cities, and then within those cities, we matched each restaurant to a comparison restaurant in the city. So, a KFC was matching with a KFC, et cetera. So what do? We did a similar sort of intercept survey, but this time it was having research assistants standing outside fast food restaurants and collecting people's receipts as they came back. So we have an objective measure of what it is that they purchase. We do this before, we do this after, right? Just like we did for the supermarket study. In Philly, we also did a follow-up telephone survey as well to see if people were changing how often they were going to fast food restaurants. So what do we see? I'm first showing you our original data from New York City. What you see on the left here is in New York, the darker line before, the lighter line after. Newark, the comparison group, again, before and after labels started. What you first see is when you just ask people as they're coming out of the restaurant, hey, did you see the calorie information? Beforehand, both in New York City and Newark, 10 to 14% of people are saying, yeah, I saw calorie information. A bunch of follow-up work has shown that's probably social desirability bias. It's them giving us the answer they think we want to hear. There was no calorie information that we saw in these restaurants, not even you could like look behind the trash can liner and find it or something like that. But afterwards it did go up, right, to around 54% of people in New York City, and didn't no statistically significant increase in Newark, right? So you could look at that 54% number and say it's great, it's horrible, it's bad, right? But it's hard to get 54% of people, particularly in New York City, to do anything, right? So maybe that's not a horrible number. When we ask the next question, did it sort of influence your choice or did it influence your choice to purchase fewer calories? We're seeing much less of an impact there, right? Only about 15%, although almost all of that 15% said they were using the information to purchase fewer calories. So what does that mean? Only about a quarter, 28% of those who saw the calorie label said it influenced their choice. And then when we actually zoned in on those receipts and looked before and after, again, difference in difference, did New York City change in terms of the number of calories purchased when Newark didn't? We didn't see anything, right? No change in calories purchased, within a statistically insignificant change and nothing happening in Newark there either. We also went back and did a study a few years later, actually 5 years later, to try to look at the impact over time. Did this take time to kick in, if you will? And just to give you one top line here, the red line up here is like, did you see calorie information in the store? What we did find is that if anything, the probability of folks seeing that information went down over time, which is again maybe not surprising as that you get habituated to it, but the percentage of people who said that they use it remained pretty consistent over time. One interesting thing to point out here is that this second round of data we initially collected not to study menu labeling, but to study Mike Bloomberg's 16-ounce soda policy. It was also often called the soda ban or the big gulp ban, where he was trying to limit the number or the size of sugary beverages that could be purchased in fast food restaurants. And so we had an R01, we were going in to study this. It was exciting. And then again, policy implementation kind of point here, it didn't happen. The court struck it down. And so we ended up having to pivot and use these data for other things. And they ripped the R01 away, which we were okay with. All right, and what do we see in terms of calories purchased? Nothing happening here, right? Like no change in calories purchased over time. Although I think we realize from this that these are policies that are not going to have whopping effects, and so we are going to have to think about other potential ways that we can study these things. And it doesn't mean that small effects that could be cumulative at a population level over time aren't important, but it does mean we weren't necessarily well powered to be able to study those sorts of things. So that caused us to shift a little bit how we were thinking about this and really want to shift to a move from less individual data to more administrative data, which I'll show you, given the way these policies are implemented and the impact they might have as implemented, we might be better powered to sort of see things in a more clear, compelling way that are still important sorts of outcomes. So I'm going to give you examples from both of the two policies I just told you about, right? The new supermarket work and menu labeling. So we're going to look at the same sorts of policies. So again, what we wanted to do is instead of looking at changes in purchasing, we actually wanted to look at changes in this study in childhood obesity among kids who are living close to the store, given some of the impacts we saw early on of some potential changes in food and beverages. So how are we going to do that, right? We're going to study the same program. It's the FRESH program. But we're going to look at weight status of children and adolescents, and we're going to look at not only one store, right, that opened, but all the stores that opened or that changed to apply for the policy. You could also, sorry, to tap into the policy, you could also renovate your store and make it sort of bigger, better. And we're going to be able to look at kind of some of those changes as well. So how do we do this, right? We do this by using data on all New York City public school kids, right? So, at this time, at least, there are about 1 million schools in the New York City public school system. We're using data that's available from 2016 to 18, although the data collection kind of kept going. We've continued to use these data. The data include really important measures for us, things like your address, where exactly you live, that's updated every year, your race, ethnicity, your eligibility for free and reduced price lunch, which is a proxy for income. Also importantly, during the Bloomberg administration, New York City started collecting height and weight on all New York City public school kids measured by either the nurse or PE teacher. And so basically what we have is a data set of all New York City public school kids, which is about 85% of kids in New York City. We know where they live, we know where they go to school, and we know their height and weight, right? And some key demographic information. So we can use this data to kind of understand other things about these kids and the impact these policies might have. So let me tell you a little bit about student characteristics for those of you who aren't familiar with the New York City Public Schools. This is data from 2021. Let me just move this out of the way a little bit. Yeah. So again, about 1 million kids in the school system there. New York City school system is majority Black and Hispanic. And so that's the kind of biggest population you see here, and then Asian, and then white, non-Hispanic. Most of kids in New York City public schools are low income, about 16% foreign born, at least at this time. It's gone up since then. 19% qualify for some sort of special education. 56% speak English at home. as their primary language. 19% obese have a BMI that qualifies as obesity, and when we look at more extreme measures of obesity, about 1.5% have that. And then you do see some of these key differences by race ethnicity, particularly for things like obesity, right? The Asian Pacific Islander population, which we know maybe we need to think about BMI in a very different way for that population, but just kind of looking at the standard obesity cutoffs is about 12% versus 25% for Hispanics, just to give you a sense of some of the data here. So, when we map this, we sort of, again, similar sort of CDC colors as I showed you earlier, the kind of greener, bluer, lower obesity rates, the yellow, orange, and red higher obesity rates. You see some of the same differences you see if you're familiar with other kinds of health measures of New York City. It's the South Bronx, Northern Manhattan, kind of parts of Brooklyn that have higher obesity rates, and Upper Manhattan, higher obesity rates, and Lower Manhattan, central part of Manhattan, Upper East Side and West Side have lower obesity rates, right? Some of this race ethnicity driven as well, for sure. So again, before I showed you just that kind of one store we were studying, and now we're going to look at these 8 stores, right, that are located not just in the South Bronx, 3 in the Bronx, a couple in Brooklyn, a couple in Staten Island, one in Staten Island, a couple in Queens. So most of these were new stores. A couple of them were expansions of existing stores. Most of them just got the financial incentives, except for the one we studied earlier, which got both financial and zoning incentives. And these opened over the period of 2011 to 2014. This happened to be where they were. So basically what we're doing is we're sort of saying, how do folks who live near the store change their obesity? How do kids, sorry, who live near the store change their obesity rates as compared to kids who live farther away, right? So we're looking at kids who live within a half a mile of these 8 stores, matched statistically using basically demographics to kids who are living farther away from the store. And we're going to look at ZBMI and obesity. We're going to look at control for actually student fixed effects, so we can kind of look at the impact of the same student over time as well in a lot of these models, controlling for some stuff about the census tract and the food and environment characteristics. We're doing weighting here and difference in difference model. So basically we have about 11,356 children who live within a half a mile of one of these fresh stores, matched to a comparison group of students who live farther away from that, but in the fresh zones. So they're folks who could have gotten the policy but didn't. And you have to sort of like realize that we're not randomizing here, right? We can't sort of randomly select where a store goes. But I think for something like this program, where there was a fair amount of variability about where they happen to find an operator who happened to have a site or could find a site that's available, it's like, we think of this as being kind of a pseudo-random or pseudo-experimental sort of study. So what do we find, right? We actually found that looked at this way, when we have a lot of power and a lot of kids, we did see, in the kind of 1 year post period, the 3 to 12 month post period, a decrease in both BMI, Z-score, and this is a proportion of kids who are obese. So remember, we had about a 19% kids who are obese. This goes down to about 1 percentage point there. Also all new fresh stores and and this was largely driven by the new stores versus the stores that just expanded, which is maybe not surprising in how you would kind of expect it works here. We could even look again, like how does it work on the ground for each of these stores as implemented? And we can sort of see that, like, we don't have an amazing amount of power to do this, right? But we can see that there's one store, this Western Beef, that I think was in the Bronx, much bigger declines in obesity rates there than we saw in a lot of these other stores. Some of these others, directionally as you would expect, but not necessarily statistically significant. So if with even more power, I think we could kind of zone in and say, what was it about this store versus this other store that really mattered? I don't know that we can really do that with the sample size we have, but at least enough to know that there is some variability here in either in the impact of it, which could be driven by the type of store, the characteristics of the store, the characteristics of the community, other things that were available in that neighborhood. I mean, all of these things could be drivers there. When we look a year later, right, for all of these stores, there does appear to be an impact, and maybe the expansion stores are ones that are kind of starting to come back a little bit and seeing an impact a little bit more there. Other things we looked at, we looked at those whose distance to a supermarket actually got smaller, right? So yes, you live within a half a mile of a store, but were you not kind of farther, did you not have a store that was closer to you? Results directionally about the same, but not statistically significant. We also looked at places where those where the fresh store was the only supermarket available in the period, right, in the area, and we did see very similar results there. All right, so that's the work on new supermarkets. I'm going to now pivot to talking to you a little bit about some further work we did looking at menu labeling. And again, what we saw from our earlier work was that there was not going to be a whopping impact from some of these policies. And so we wanted to think through a way to be able to study it in a more nuanced and in-depth way where we had the power to look at small but potentially meaningful effects. And so we actually pivoted to using data from a large national chain that provided us data to look at some of these changes in purchasing. So the other positive about this sort of approach is we can kind of look at, again, not just 1, 2, or 3, or 40 stores, but we can look at the hundreds of stores that might have impacted that might have been impacted by these menu labeling policies. And we could look at some of the differences by things like, the income or race ethnicity of the neighborhood, or how urban versus rural it was, or, what about time of day versus day of week? What about drive-through versus in-store? We have the ability to kind of do this in a clearer way. And this is some of our research team actually at Taco Bell, which is the company that gave us the data. All right, so the study, most of what I'm going to show you today comes from about 6,000 restaurants. Let me just tell you a little bit about Taco Bell. It doesn't have a huge presence in New York City, but it's a very big chain nationally. They're in every U.S. state. They have about 35 million customers per week, or about 11% of the U.S. population. Half the U.S. population eats Taco Bell at least every month. The average Taco Bell customer eats there about every 11 days. So this is something that, is all over the nation and is well consumed, right? So in contrast to looking at a wider variety of stores like we did with some of our earlier studies, we're going really in depth here on in one store, but it's a store that is, consumed by a lot of folks. And so I think we have kind of issues to think about here in terms of generalizability versus the depth of study and power of study we can do here. And so those are some interesting kind of considerations here. We have data from Taco Bell on basically every transaction made. We've gotten it since subsequent to 2015, but today I'm going to use data about from 2007 to 2015 in our study period. It's 5.2 billion transactions, about 150 million per quarter, representing over 3,600 unique food and beverage items. What do we get? We get basically everything you can think of coming from a receipt, right? All the items purchased, was it drive-through or in-store? How much did they pay? Did they get any discounts? How big was the serving size? Was it a combo meal? Did they customize it? Did they say no cheese, add sour cream, that kind of stuff? So like basically everything that you would need to make the order, if you will, is available there on the receipt. We also have restaurant level data. So, where is it? Was it co-branded with anything else? Meaning, was it like a Taco Bell / KFC? Did it have a drive-through? When did it open? How big was the building? Did it have parking there? Like other things like that we could think about incorporating into our analysis. I'm not going to walk through this, but just to say it was a very complicated, involved process to go from information on a receipt to actually translating that into how many calories it had. Even though there was a good data set already, a kind of item level data set that had already been put together that had the number of calories that each item had, but basically it involved a complicated set of both kind of machine learning approaches and then RA on the ground, based approaches. We think we were able to match over 95% of all items. So we were able to do a really good job with this, but it took a lot of work to really be able to kind of make that clear link and distinction there. So let's talk a little bit about how we're doing this. So before, as I mentioned, we were able to study, one city in 40, a couple different cities in 40 stores. Here we're able to study the kind of 6 you see there: King County, which is Seattle; Montgomery County in Washington; Suffolk, Schenectady in New York; the entire state of California, and the entire state of Vermont. Right. So these are places that had Taco Bells that implemented these policies at the state level in the time period you see there. So that ended up being 474 restaurants, most of which were in California, that we were able to look at. We're doing a similar sort of design that I showed you before, a difference in different sort of design. This is the model we use. Although because we have such power and depth of data, we're able to look at kind of a month by month post period. We're not just sort of like lumping together the entire 1 year post period like we were before. We're able to look like how do things change on a month by month basis. So the basic design is, did anything change? And for example, King County, Washington, Montgomery County, we can look at them at some point. I'll give you some examples individually, sometimes together, as compared to comparison groups. And we're using synthetic controls, which we don't have super amount of time to get into today, but it's basically a way for us to get a really very good match. And I'll show you this in a second, in terms of the actual matching to the restaurant level. So we're able to kind of match a particular store in King County, Washington, Seattle, Washington, to actually a combination of stores that look like that throughout the entire nation of Taco Bells. We're also including things like seasonal fixed effects, like is it January, February, March, because we know that changes how people consume. And we're including restaurant fixed effects. We're looking at changes within the same restaurant, right, as compared to its comparison restaurant, its synthetic control. So what do we find, right? The first thing you see here on the left-hand side is that, this is both the kind of the darkerish color is the comparison group, the lighter blue color is the treatment group, the places that implemented the policy. What we're seeing here is that, not only do we have what's called good parallel trends, like not only does the comparison and treatment group move together, but they're actually like right on top of each other, more or less, right? So we have really kind of good, we're able to get kind of really nice matching here. We had a kind of a 2 to 3 month on either side. We played around with it, to being about 2 months washout period, where we said, like, let's give a little bit of time for the policy to be implemented, for the new menu boards to sort of go up. And then let's look at what happened after that. And so what you see pretty quickly is that there is this deviation here, between the number of calories in the kind of comparison group and the treatment group, where the treatment group goes down, right? Just to give you a sense here, like these are the number of calories where, or the mean is about, let's say 1,050 or so in the pre-period, and this orange line here is the difference between those two things, and you can see that there are very small differences, right, around there. This dashed line here is about 25 calories, and you see that once we get to the post period, we do see kind of jumping up and down around that 25-calorie line. So there are some differences there that we see. And so what we're going to do is, again, that statistical model I showed you before, a difference effect, kind of comparing the pre to the post period. And when we do that, we see that there's about a 19.2 calorie difference in the first year, about a 29.2 calorie difference in the second year, right? And then average over the entire post period about 25. So when we're able to kind of zone in like this and have a different sort of power, we are able to see that there are potential some impacts of this policy. We can think about whether or not 25 calories is good or bad, right? Is that is that likely to change the obesity rate trends by itself or impact diabetes? No, probably not. But when you start thinking about if this is representative of what happens when people go to fast food multiple times a week, right? Maybe you are going to see some changes here. The other trade-off of these sorts of data is that we have, again, really powerful data, but I can't look at whether or not, the person eating that food, I don't know anything about their race, ethnicity, their age, their income. All I know is, like, they had a particular transaction, right? And so that is one of the limitations here. One thing we were able to do is look at, let's at least break this down by, the 450 stores we had that came from California versus the 24 stores that came from those other 5 locations. We do see some differences there, right? We see that California, which again, big driver of our sample, not surprisingly, the results look very similar to what you saw on the last study, in the last slide. This is just the difference in difference results. So we see that there's kind of a pretty consistent 20-ish calorie, 25 calorie difference. We see like not anything statistically significant overall for the other locations, right? And so again, we're not necessarily able to have the power to break down well the other non-California locations, but we do know that there are some differences there, right? And again, could this be about how the policy is implemented on the ground? Maybe, although this is a place where the restaurant owners, who generally were franchisees, didn't have the ability necessarily to change what the menu board looked like. They were shipped that menu board and had to put it up. So, could policy implementation be part of it? Maybe. Or is it more about how that implementation impacted with or interacted with the individuals on the ground or that particular sort of food environment? I think that's maybe a more likely sort of scenario that we'd have to think about. That, again, we don't have great data to be able to answer this. We have done some work to try to zone in on, at least particularly for the California stores where we see an impact, do we see differences by whether or not the race ethnicity of that neighborhood or the income of that neighborhood? And the answer is like not so much, right? It doesn't appear to be hugely driven by at least those things that we can observe overall. But again, we can only look at so much at the kind of broader census tract level. So that's the work we did there. We're also using those same Taco Bell data to look at some other things, right? So we're starting to zone in on looking at beverage taxes in the US. These are the places that have implemented sugary beverage taxes. So Philadelphia, Albany, Seattle, Cook County. They started in kind of the 2017, 2018 period. They generally are about a cent to a cent and 1.75 cents per ounce, right? So think about, a 30-ounce beverage is going to be 30 cents more for a cent per ounce. Most of the taxes, not all of them, most of the taxes target just caloric sweeteners, so just actually sugary beverages. Two of them, Philly and Cook County and Chicago, actually targeted caloric and non-caloric sweeteners, so diet beverages counted as well. Partly for political reasons. The mayor of Philadelphia, when he was trying to implement this policy, didn't make it about obesity. He basically said, we need money to help with preschools and parks, and this is a good source of us to get that, right? These are not products that people have to drink. And so this is a way we're going to go it after. We're not just going to make it about the regular sugary beverages. We're going to make it about the diet beverages as well. So that's kind of one distinction and difference in these policies. The other interesting thing is that Cook County actually repealed their law, right? So it was only in effect for a few months. They repealed it right afterwards, after getting a lot of pushback and blowback. So that also makes kind of an interesting way that policy was implemented and then unimplemented effectively, and allows us to study things in a little bit of a different way as well. So again, we use the same data, right? We use the transaction level data from this from Taco Bell. We studied these 5 implementations. Still under review, but the kind of short answer is that we didn't see any substantial change in purchasing. Like these are the kind of locations that implemented it, and then the other blue dots that's the red dots. The blue dots are the comparison groups. Looks very similar to the last map I showed you because it's the same Taco Bell data. Here we're really going after what we call an event study design. So we're looking at each of these 5 locations, Albany, Oakland, Seattle, Cook County, and Philadelphia, looking at each of them individually. What we're first looking at here is what's called pass-through, right? So if I'm a retailer, right, and I own this Taco Bell, when I actually implement when I'm starting, these taxes are I, as the owner of the Taco Bell, have to pay the tax, right? And so the first question is, do I pass that tax on to the consumer? Do I actually change the price of the beverage to match that tax? It's called pass through. And basically what we found is that, in Albany and Oakland and Seattle, they basically didn't, right? There was not a statistically significant kind of change in the sort of price per ounce of that beverage. In Cook County and Philadelphia, and if you remember, those are the places that actually tax sugary and non-sugary, they did, right? We did see more of a change there and how those taxes were actually resulting in changes in prices. And not necessarily exactly like kind of full pass-through, if you will, but they are passing through a fair amount of the tax. Might have slipped a little bit in the second year, but we see something happening there. And like, look, this could be about, it's easier for me to implement this policy or to have this policy have the impact policymakers might have wanted it to do when I'm able to actually, put it on all my fountain beverages versus just say like, oh, if you get this kind versus this kind, you don't have to do it. If you think about the implementation context here, for people who come in the store, most of them are given a cup and they're able to kind of fill up the beverage themselves, right? And so I don't know if you're going to be getting a diet beverage or caloric beverages or seltzer or something like that. So that could be kind of what's about how the way the policy was written caused a different sort of impact in terms of the change in the actual prices. Now, when we look and say, okay, well, what about actually purchases, right? Again, using the same sort of receipt data we saw you before, basically we didn't see much going on here, right? We didn't really see any that was an appreciable enough price change, even in Cook County and Philadelphia, to actually change the number of calories that people are purchasing from beverages. Looked at a couple different ways, right? Looked at from the perspective of um, uh, individually purchased beverages, right? Like I just go in and order a medium Coke or I order something and order a medium soda. and for kind of combo meals, things that were bundled together that come with a drink as well. We didn't see any really appreciable change there in the number of calories that were purchased. Another interesting thing that I forgot to mention here, going back to Chicago, Cook County, if you remember, like, the policy started here and ended about 4 or 5 months later, right? But what we didn't actually see is that there was any change in the prices of beverages at that point, right? So retailers did raise the price after the policy was in effect, but they did not lower the price when the policy went away. And this is a little bit contrary to some of the data that comes out of supermarkets, where we know that they actually did change and decrease they increased the price and then decreased the price again. But these retailers actually didn't. And it's hard to know why. Did they notice, and like we showed in the slide I just showed you, that actually didn't change people's behaviors? So why not get a little bit more profit margin on these sodas, right? But we noticed that they didn't make those changes subsequently in Cook County. All right, so let me kind of end and then have some discussion about a few different thoughts on policy implementation here. I think one kind of key question is data, the type of data you use to do these studies. I think we saw early on that this food environment work it wasn't going to be a silver bullet. It wasn't going to have a whopping huge impact. It wasn't going to necessarily, any of these things by themselves change the course of obesity, right? So that really did cause us to change the way we did this work and to shift a little bit more towards administrative data, where we had a substantial amount of greater power to be able to answer this stuff. I think another key question with respect to policy implementation is, how do you think about policy implementation using some of these large scale data, right? If you think about, let's say, menu labeling, right? I know that the retailer got shipped a new menu board from Taco Bell, right? I have data that shows that that's true. Do I 100% know that they put it up, right? Or that they put it up in exactly the right way, or that they altered it at all? No, and they're not supposed to, and that's against their rules of their agreement with Taco Bell. But, when I have the trade-off of having 474 restaurants from across the nation, is that I don't necessarily have the ability to go in and kind of check that. Um, you know, um, for some of our work looking at new supermarkets, right? Yeah, we could have. There were 8 of those, right? We could have gone in and looked at each of those supermarkets and understood a little bit about them. But, oftentimes we're doing this study 3 or 4 years later when the administrative data become available, right? So it's not clear that at that point going to this store to understand what it looked like and how the policy was implemented on the ground would have been particularly meaningful there. But I think those are some of the kind of trade-offs we have to think about. And I think it is really important for us to think about how do we get the best of both worlds here, right? How do we kind of think about some of these large-scale policy analysis that I think we really need to be able to study these sorts of policies well, with a deeper understanding of what's actually going on the ground. How are these policies implemented? I think that's another really important kind of consideration there that we need to think more about. And what are these trade-offs for both kind of research and future policy? I think in a perfect world, we would have loved to have eyes on the ground in each of those 474 restaurants that implemented menu labeling across the country, and then wait a year or two and then get the data and then understand what happened, right? And that's not always feasible, right? Although maybe we need to continue to work towards that perfect world. I think that's an important consideration. At the same time, I also think that we need to kind of figure out how to make more administrative data available to really understand these policies in a more in-depth way. Is that where we should be putting our efforts, right? Or is it a combination of both of these things? I think thinking about these things in the trade-off is important, not just for research, but for thinking about future policy and how these things are implemented. So that is what I have for you all. I want to thank a whole bunch of collaborators and funders, largely from the NIH as well. And I really appreciate it. And I'm looking forward to your questions.
Great. Thank you so much. That was amazing. Super interesting. So much work, all those receipts.
Yeah, all those receipts,
Okay,
right?
so yeah, hopefully you've inspired some people about new data sources. You have a few questions, so I'll try to kind of sequence them. So let's start with one about results, and then there's a few about kind of interpretation and implications. So one about results, someone asked, since you have the order customization data, you might be able to see differences in pattern and just underlying dietary habits in different areas. Did you look at that? Did you see any of that?
Yeah, good question. So we did do that in our earlier less powered receipt work, we tried to sort of say, all right, like maybe overall calories didn't change, but can we sort of see like people are making subtle changes, right? They're kind of like taking cheese off something, or they're, and we didn't actually see much of an impact there. We have not gone back, although it's on the list, to do that for the better powered work, right? Because I think you could see that. We have to be a little bit careful with that. We have so much power that we can see very, very small things as being statistically significant, right? Like 2 to 3 calorie changes like show up as statistically significant for us, right? And we don't attribute things that small to the policy. So I think we can do that. We just have to be really kind of thoughtful about some of those trade-offs and how we interpret it.
Yeah, great. Thanks. Okay, another question about this sort of policy specifically. Someone asked essentially about like unintended consequences. So, if you changed your calorie consumption, at a given place due to the information, maybe you then wouldn't go back there in the future, or you might spend less money there, or your sort of spending habits might change in a way that might affect the shop owners and the franchise owners and so on. So curious to hear your thoughts about sort of the maybe unintended like implications of public health promotion policy
Yeah.
on business owners.
Yeah, it's a great question. And I think you can think about unintended consequences in a couple different ways. One of them is how you're describing. How is this going to impact the retailers? And who are many times small business owners who aren't owning hundreds and hundreds of shops, they're owning one or two, right? And so, we did do we did not notice a decline in the number of transactions in our data after the result of these policies. So it doesn't look like people are kind of leaving in mass. In our earlier work, where we did telephone surveys, got people on the phone and say, hey, how often do you go to fast food? And we didn't notice any change there either. The biggest worry folks had about unintended consequences with respect to the policies we talked about today were soda taxes, driving people away, and what's going to happen to the small business distributor that distributes that soda, right? And those sorts of things. Most of those, and some studies have directly looked at those sorts of impacts and have found that it doesn't look like there's anything going on there. Oftentimes because consumers are shifting to purchasing other things, and those other things need to be distributed as well, right? So the other way to think about, I think, unintended consequences, which did have a fair amount of discussion when, for example, a menu labeling policy had rolled out, was what about folks that struggle with eating disorders, right? Is kind of putting the number of calories in their face going to be a problem there? And some experimental work showed that maybe is something we need to be particularly careful with in things like college dorm cafeterias, right? And so I think some dorms have implemented those sorts of things in different sorts of ways, although I think in that case, it's kind of looking at the preponderance of the evidence, like what does it show us about good versus bad? If these policies actually weren't doing anything for nutrition and obesity, but were causing problems with eating disorders, that would be something we'd want to know and kind of understand the cumulative influence of these sorts of policies. The kind of final unintended consequences that you heard most discussion about was around soda taxes, and that it's effectively, let's call it a regressive tax. So it impacts the low income folks more. And so like many were arguing against them for that reason, right? Like this isn't good. Why are we taxing something that's gonna like going after a class of products that's perfectly legal? Yeah, maybe it's not great for their health, but it is a source of enjoyment and positive utility, if you will. And so is that something we should be doing, right? So that's the other way these unintended consequences were, and that's generally tend to be an ideologically driven kind of choice versus a data-driven one. I mean, we can look and say, here's the impact that these policies have on particular populations, but then how you trade that off with the kind of disutility or negative component of it for the particular populations is really a political or personal choice.
Great, thank you. There's a couple questions about sort of like, have you looked at or thought about some other policies in this space? So I'll ask you about those. So you brought up dorms. Someone asked if you've looked at school food policy. Yeah, school food policy.
Yeah, we've done some stuff in school food policy in a couple different realms. We have looked at some of this is more extended collaborators and some of than me, but me and my collaborators have looked at things like breakfast in the classroom, right? So this is a policy that started in New York City a long time ago and now has gone to many different places where breakfast is free in many public schools. It's been free in New York City for a long time, but for a while there was a stigmatization associated with it. Like you were the poor kid who had to go in there early to get breakfast. And so they changed that to actually, let's think about making it available in the classroom, right? We're going to bring it in there, or we're going to let everyone grab it as they're walking into the room. There's less stigma associated with it. You're getting it because it's there. And many hunger advocates were really excited about this because they thought it's going to be great and it's going to reduce stigmatization and kids are going to get fed. Some obesity folks were worried, like these kids are eating at home, they're stopping on the bodega on the way to school, and you're going to feed them again, right? Is that really the best idea? And so we did look at that policy using the same New York City data I showed you and found that it actually didn't appear to do anything to obesity rates, but it also necessarily didn't do very much for test scores, which is what folks were hoping it was going to be helpful with as well. So maybe it's like, if kids are less hungry and we're not doing anything to their obesity, and maybe that's a good thing, right? We've also looked at things like universal free meal. So what happens when you make school meals free for everyone, right? And we found that that increased participation quite a lot and didn't appear to do anything for obesity rates, right? And maybe even helped test performance a little bit, right? So those are some of the things we've done on the school meal side.
Great, thanks. Someone asked about whether you've looked at the NYC food standards and whether that has changed consumption behaviors in city agencies.
Yeah, it's a great question. Just to give the folks what these are. So New York City a number of years ago rolled out food purchasing guidelines that basically said, like, if you are purchasing food for consumption by folks that the city for people where the city is paying, you have to kind of meet a certain set of standards, and we haven't actually. It's a good question. It's hard to zone in and find a population that is going to be like particularly impacted about it, that we have good data on, right? We have tried to think about some school food standards that have changed over time, but a lot of them have been like a little bit diffuse, and when they've got kind of phased in, have been like there's not kind of a stark policy line, so we actually haven't been able to look at that yet.
Thanks. It must, yeah, I mean, obviously finding the right population that you can measure these outcomes in a large sample size so you can pick up small differences is a challenge with them.
It's tricky, yeah.
Okay, also got a question about the Healthy SNAP Act and how that might impact public health outcomes and, particularly limiting SNAP benefits so that you can't use them on sugary beverages or junk foods, and any thoughts or experience looking at that?
We have looked at that. I didn't lead the study, but Lisa Harnick at the University of Minnesota led the study, and I was lucky enough to be part of it. A couple different studies that we did on that. One was both of which were RCTs. The first one was finding folks kind of just over the eligibility threshold, right, for SNAP. And we basically enrolled them in our own SNAP program where we randomized them to get SNAP as it exists now, SNAP that restricted purchases of basically mostly sugar sweetened beverages and some kind of cookie snack sorts of things. A third condition that gave them subsidies for fruits and vegetables, and a fourth condition that did all of those things. And we found that all of the things worked better in terms of improving healthy behaviors than none of the things. But each of the kind of components mattered there. Did a subsequent study that actually tried to enroll people who were like actually eligible for the program but not enrolled. And interestingly, the results were not quite as robust, right? It didn't appear that it was like necessarily had the same sort of impact, right? So I think obviously that was a big kind of important policy discussion, less so now. A while ago, New York City was trying to implement something like that and couldn't quite get permission from the USDA to do it. This is also something interestingly where kind of hunger advocates and obesity advocates came to loggerheads a little bit. Hunger advocates were thinking, don't mess with our SNAP program. This is a really important program, and it's done more to lift people out of poverty than anything else. And the minute we start allowing for, politicians to come in and find the thing that they like and tweak, then it's the death of it. Folks on the obesity nutrition side saying, why should the government be buying this bad stuff for people, right? And so I think it's an interesting set of discussions, and I think the data shows that there's some impact that you could get from doing this stuff, although it's not going to be, again, a slam dunk here in terms of dramatically changing rates.
Thanks. Someone asked about the Fresh Store study, and the question was sort of how do local residents benefit from having a fresh store besides it being close to them? Are there sort of lower prices or other ways that we would think the benefits would show up for folks?
Yeah, good question. So the only requirements were the ones that I laid out there, right? So like it had to be a real grocery store, it had to have real fruits and vegetables. It said nothing about that they couldn't have all the middle aisles of grocery stores, which are a lot of not great for you stuff. It didn't say that how you had to price those products, whether or not they had to be like, attractive to the community. Presumably you're not going to stay in business if they're not, but it wasn't like that they kind of dictated any of those other things. The city has gotten pressure over the years to try to dictate some of those other things. And their response, and I think this makes sense, is it's hard enough to get retailers to come to a lot of these neighborhoods. And if we make it any harder, they're not going to come at all. Right. And so like we don't feel like we have the ability to kind of do that. So it's a new store. It isn't necessarily a new store that's cheap, right? The other potential benefit, which we haven't looked at, but folks talk about it, is like this is a new, often pretty good employer in the neighborhood, right? And so we know the employment effects of health are really quite large, and the income effects. So like maybe there could be positive benefits to the community in that regard. Maybe that store is going to be an anchor sort of store, and other retail that people can start around that is going to be an important thing. Potentially important kind of also gets to the ancillary outcomes sorts of question earlier, that we haven't studied, tricky to study. Like I think we could get some more kind of anecdotal stuff, but it's not something we've zoned in on in any kind of super deep way.
Great, thanks. Speaking of things that are difficult to study, obviously one big one was, as you noted, like the implementation of these policies. Like, yes, you got a new menu board, but I don't know whether you actually put it up. And so there was a question about getting creative with a way to measure this. Like, could you, for example, look at random snippets of security camera footage and see and sort of check if these policies were implemented? Any thoughts on ways to sort of creatively measure implementation?
The closest we got to that, it's a really good question. The closest we got to, and I think we're probably in a different data frame now than we used to be back then, but we thought about using pictures that people post on Yelp reviews or Google reviews to try to do that, and found that we could do it in an inconsistent sort of way. It wasn't like in the periods we needed, there was enough people actually posting it there to do it. Although, I think it's something we need to think more about, right? Like, let's go back to the question of did a new supermarket with the Fresh program seed other kind of businesses around it? Like, we do have that on business opening and closing, right? Like, maybe we could do something like that. Or maybe there's like Google Maps comes through, or Google Street View comes through every few years. Like, what can we use there to understand like traffic to the store or something like that, right? Cell phone data about where people are moving, which is readily available now. Like, so I think we probably could do more, and I would love to hear from any of you all about ways you think we might think about this implementation work in a deeper way about how we can do that, right? I mean, I think it could be something interesting. I mean, I think that the security footage would be really cool, although I think that that's again individually owned by each of the stores and not something that they give to Taco Bell centrally, so that becomes tricky. But I think there's other ideas that we could think about.
Well, thanks. Okay, you got a couple questions that I'm going to like coarsely summarize as saying, it seems like there's a lot of really robust results that you presented, but of pretty small magnitude.
Yep.
And so like what should be our kind of takeaway feeling on this? Is it like this sort of sets of policy approaches that give consumers information, or, like consumer choice policies maybe is not the right policy direction for this issue? Or, are there tweaks that could happen to these policies that you think would change their impact? Or what do you think our takeaway should be from this very impressive set of relatively small magnitude results?
Well, I mean, it's a really good question. And it used to be that before we started doing this larger stuff on administrative data, like all of our studies were like null, right? Like I built an early career on a lot of obesity advocates not liking my work because it showed that a lot of the stuff that they were excited about didn't work. So when we look at this evidence as a whole, I think we can think of it and interpret it in a couple different ways. I think one, for things like labeling, I think that and there's other kind of labeling like policies that are still coming out, right? New York City is about to implement a sugary warning label for sugary items, like they did one recently for sodium. So these things are not kind of like going away necessarily. Many would argue that this is like a right to know, right? Consumers should know this stuff. It's like, the same way you're required to know where the clothing you wear is purchased and what's in it, like you should know what's in your food. So I think that there's like one stream of arguments there. I think that it is very clear now, though, that these policies on their own are not gonna dramatically, if at all, change obesity rates. I think that it could be important to a subset of folks who have particular health conditions, right? You're dealing with hypertension, you're going to maybe zone in on that salt shaker. You're dealing with, diabetes. You want to know calories and see that sugary item. So I would love for us to do more studies on individuals who have particular health conditions, so we can kind of really important ones, like not like niche ones, like important ones that are even at a population level could be really important. Will that said, will these individually change population level rates of obesity and diabetes? No, right? Will they in combination, like, if you think about taxes, which do have a bigger impact in stores supermarkets than I showed you in fast food restaurants. Like, would taxes plus menu labeling plus some of these other sorts of labeling, like, will that over time change things? I don't know that we know that yet, right? Uh, I can make the argument yes, and I can easily make the argument that it won't. I think that these are still probably pretty important policies when you think about it from the perspective of, we have a new a new population of folks coming into the world all the time, and kids that are kind of exposed to these things in a different way. Is their exposure going to be different? And when you combine it with other sorts of things and a greater sense, and maybe there's something going on there. Do I think these things are going to change a kind of stable cohort of adults? Like, probably not, right? That's why I'm really excited about these new obesity drugs, right? I mean, I think that there's a lot to be said, like all kinds of trade-offs and questions there, but I think like it's nice to have something that can actually work, right? That we can sort of offer people. I don't think we should give up on these sorts of things, but I do think we need to think about other sorts of solutions. I mean, I think the thing that we know is like most impactful which is really, really hard to change policy, is the uber availability of highly palatable food that is marketed like crazy, right? And it is really hard to kind of strip some of that from the food supply. Like, it's just increasingly difficult to do that, right? If we could do that, do I think that would be more impactful? Yeah, I think it could. And I'm not holding my breath for that tomorrow.
Yeah, someone asked in the Q&A about sort of like more aggressive policy, like blocking of ads and marketing and, which other countries do, but the US hasn't. So
Yeah.
maybe we'll end on this, like kind of thinking about other policies and maybe widening the policy space. If you have any thoughts on exactly this, like maybe there are sort of more aggressive policies that are needed, or what are your recommendations on the set of policy tools that we should be thinking about?
Yeah, I think that some of the marketing stuff that other countries have done is really compelling, and I think you're starting to see some evidence of that. Some from the UK, some from Chile. That maybe it's going to matter some. Although you have to make it pretty aggressive, I think, to really work. One new policy that my colleague Marie Bragg and I are studying is a bunch of states have started to restrict how kids can access social media and or how the algorithm can direct themselves at kids, direct used to direct ads to kids. And so we're studying two states that have implemented that, Louisiana and Texas, particularly looking at food and beverage advertising exposure. I mean, kids are seeing a tremendous amount of food and beverage advertising exposure from social media. It's probably most of where they're getting their advertising now from, like it's gone out of TV, right? Like, we mostly don't see advertising on children's TV or on a lot of TV anymore. Like, they've kind of they've wrenched down on that. And or kids are just not watching, television in the same sort of way before, but they're seeing tremendous amounts there. So like maybe those sorts of policies, which aren't necessarily meant to target food and beverage advertising, could matter there. So we're like in the middle of that study now, and we'll see how that looks. So I mean, I think that there are maybe around the edge of stuff we can do before we kind of have but even if you look at the policies that have the countries that have been a little more aggressive, like they're still not keeping chips from bodegas, right? And now, I mean, that's just really, really hard to do. And I don't know that we will ever get there. And, maybe we shouldn't. But I think we do need to think about some of these other sorts of solutions.
Great. Amazing. Thank you so much. I mean, the
Thanks so
talk
much.
was great.
Great
I have
questions. Yeah.
questions. Yeah, amazing questions. Really enjoyed the discussion. It was so great to have you. Hopefully people in the audience have their brains ticking on how to measure implementation stuff and ways to use data like this for other public health
I'd
questions.
love to
And
hear it.
thank you for
Yeah.
joining us. It was great
Thanks
to
so
have you.
much. Really appreciate
Have a
it.
great day, everyone.
Bye.
Bye-bye.